anticipate it will involve guidance on masking outdoors, as well as further guidance on what fully vaccinated people can do as they expand the safe activities for those vaccinated people. I would also anticipate that as the state and federal guidelines are updated over the next few weeks, that indoor masking will be the last protection to be removed. So that needs to continue. As the governor has said, he's hopeful that we'll be relaxing restrictions in many areas by June 1st if the state gets to the appropriate vaccination level. That's what we're going to anticipate today. So I think as time has gone on, just like it has happened through the whole pandemic, we learn more and more about all sorts of things, about the best treatment for COVID, about how the vaccines are working, and certainly how it's spread. And that information has evolved. Remember, this was a virus that, not that long ago, we didn't know existed. So an amazing amount of work and knowledge has been gathered, and part of it is around, how it's spread. And so as we've mentioned before, big open spaces with really good ventilation and airflow, and the ability to stay far apart really help in preventing transmission. And so I think what's emerging is that certainly if you're fully vaccinated and you're outside and there's breeze and wind blowing around, the chances you're going to acquire COVID are really low. Most acquisition of COVID through the pandemic has been in indoor spaces and in tighter spaces with more people there. So bars and restaurants and homes and those kind of tighter spaces. So I think what I anticipate today is that CDC will give guidance that certainly fully vaccinated individuals will not need to wear masks when outside. And I anticipate they're going to give a little more guidance on what other things fully vaccinated people can do or they feel like can be done safely. I don't want to speculate on all that just yet. But I think the thing we can probably bet on is masking outside will be optional or removed from the recommendation list. Deal with surges in volume as we've done before. We hope it doesn't get to the same as that peak we had in January, but certainly as things open up and precautions are lifted and people aren't quite as diligent as they were, we're going to see increased cases. And we've seen that over the last few months. Has again had a huge spike, and we can handle the volume. So I would anticipate that would continue to happen. I think if you look on the national mood about all of this and you listen to public health experts around the country, I think the idea of herd immunity is kind of falling by the wayside. I think there's this realization that enough people in the society have said we're not going to be vaccinated, all that number has gone down, that it's unlikely that we're going to reach a herd immunity where suddenly COVID is gone. It's going to be something that circulates in our communities, much like the flu does now, even though COVID is a more serious illness than the flu, and will likely require boosters over time. And the hospitals will have to be prepared to deal with those patients, maybe on a seasonal basis. So I think it's unlikely we're going to reach a state where at a certain date, we've gone down to almost nothing because everyone was vaccinated and off we go. I think that's just decisions that kind of we as a society have made, and where the healthcare systems are going to have to deal with that on some level. So we're prepared to do that, and we have the supplies and the bandwidth to do it. But we would again encourage everybody, get vaccinated and talk to your providers if you have specific questions about it, because the more of us that are vaccinated, the less COVID will be circulating in our community.